Hello class, hello professor. My name is Lennart Mahmoudi. Today is July 3rd. I am going to do the orientation or oral video of my subnote in regards of community acute pneumonia that I seen this patient in a clinic. My patient ID is HK, date of birth 6/18/1958. He just turned 67. He's an Armenian white male. He present in the clinic and unaccompanied, and he appears to be a reliable historian. PC number 3675-304. HK came to clinic. I have had a cough and fever for the past 4 days. HK, he reports a cough and fever for the last 4 days with a productive cough with a yellowish greenish sputum. His fever was 101.8, shortness of breath on exertion. And he was pleurotic chest pain on the right side. He also noted that he feels fatigue and chills and reduce of his appetite. He denies any night sweat, recent traveler. He rated his pain 4 out of 10, non-radiating, pressure pain on the right side, which gets worse with the cough. And when he stops coughing, he has, there's no pain. He had no contact with a sick person. HK's past medical history, he has a hypertension, which he was diagnosed 5 years ago, and his disease been managed by medication. He had his last physical around beginning of June in our office, and he had his eye and dental exam last week. Other than that, he's a healthy individual. He had an appendectomy when he was 30. HK has no medication, food, environmental, or latex allergy. He received all of his childhood vaccination. His last flu shot was in September of 2024, and he only had 2 doses of COVID vaccine. And he also received his pneumonia vaccine in 2023. Social history, HK is a sales manager at a car dealership. Basically, he does have a stressful job, and he tried to manage his stress with exercise. He is not planning to retire yet since his boys are getting ready to get married, and he wants to help them with their wedding and their first home that they want to purchase. He's sexually active with his wife of 40 years. He's been smoking for 40 years. He admitted of smoking a pack of cigarettes a day. He drinks alcohol on occasional basis, but he denies use of any type of drugs. He drinks 2 coffee a day, but no carbohydrate drinks. His diet is a Mediterranean diet, which is a combination of the protein, carbohydrate, and vegetable. He sleeps 6 to 7 hours a day, but he mainly works 6 to 7 days a week. He has a gun at home, which he keeps it on the safe box. They have carbon monoxide detector and a ring alarm at their home. They keep their medication on their bedroom next to their bed. Since the boys that are grown up, they don't use any lock cabinet for medication. If he has a spare time beside his exercise, he spends his time with his family, especially with his wife. Family history, HK lives in a single family home with his wife of 40 years and 3 sons. His father died at age of 80 due to brain tumor, and his mother is 82 years old and has a history of diabetes and hypertension. He doesn't remember of age of his maternal grandfather, but he knows that he died after fall and a long-term hospitalization. His maternal grandmother was at age of 85. She died at age of 85 due to old age, and she never took any type of medication. That should be a healthy individual. Both parental grandparents died at a young age due to a car accident. He does not remember his paternal grandparent. He has an older sister, which she has a history of hypertension, which managed by medication for the last 15 years. He denies that he admits to be his fatigue, chills, and he denies any night sweats. He admits has a productive cough, dyspnea, right-sided pleuric pain. Cardiac-wise, he does not have no palpitation, no chest pressure, or skip of a beat. GI-wise, he do not have no nausea, no vomiting, or no any type of abdominal pain. No confusion, dizziness, or memory loss. We checked his vital signs. His temperature was 100.8, which I did orally. Blood pressure 138/84 after medication. Heart rate 96, respiratory rate 22, SpO on 92% on the room air. Pain, he admitted 4 of 10. Weight, he's 168 pounds and height 5.9. His BMI is 24.8. We did some labs and diagnostic testing. We also did a chest x-ray and this PCR for the COVID and sputum culture. Physically, he's oriented, looks fatigued, mild respiratory distress, lungs crackle and bronchi breath sounds over the right lower lobe, dullness to percussion. Cardiac-wise, normal S1 and S2 on auscultation, no murmur, no gallop. Abdominal was soft, no tender, no organomegaly. The diagnosis that we had for him, community acute pneumonia due to this is based on the evidence that we have and the sputum and the findings that we had on the lung findings. The differential diagnosis that I have for this patient is acute bronchitis, COVID-19 infection, and lung abscess, which each one of them follow up with the diagnostic testing, we can rule out or rule in. But at the moment, they're all ruled out. The diagnosis for him is community acute pneumonia. The plan is medications and follow up that the patient needs to education, which one of the education is the cessation of smoking, stay hydrated, complete his entire antibiotic course that we prescribed it for him. And then he's cover his mouth while he's coughing. And if for follow-up, and also if he's for follow-up appointment 48 hours or sooner if his symptoms got worse, and then we can also review his chest x-ray and lab results. Consider hospitalization if he feels or his hypoxia got worse enough. Anyway, thank you for the video and have a happy 4th of July.